one nursing student. Can I get an S bar for this patient?
Yeah, the patient's Martignard, 80 years old, full code, no known allergies, in room 529. Patient has a non-healing sacral ulcer, stage 3 that they've had for about 3 months. The patient has been treated on an outpatient basis with little success. The patient was administered from the physician's office. Blood culture is positive for E. coli, and white blood cell count is elevated at a 12.5. Patient's alert and oriented and very cooperative, just slightly anxious. They complain of some generalized weakness, and the gait is coordinated, but it's a little bit slow. The chest expansion is symmetrical. It's clear upon auscultation, but the lower left and right lobes, there are some diminished breath sounds. The patient also has a history of dehydration as well as pneumonia. The patient's peripheral pulses are 2+, pedal and radial. Also, the capillary refill is less than 3 in all 4 extremities. The patient's going to be NPO. They're scheduled for a surgical debridement tomorrow, so after midnight tonight, they're not going to be having anything by mouth. The patient's abdomen is soft, it's non-distended, non-tender. Patient is slightly obese. Stools are brown. The patient is on a special diet, just like a regular diet, but they're going to be NPO after midnight tonight. The patient has an occasional stress incontinence with nocturia. Intake was about 850 milliliters. The output was about 350. Just going back to the sacral ulcer, it is 4 centimeters in diameter, a centimeter in depth. It's full thickness, and the edges are macerated. The patient's vital signs, if we're taking it 14-15, temperature is a little bit elevated at 99.1. Heart rate's 88. Oxygenation is 92%, and the blood pressure is 144/90. Patient has been prescribed gentamicin, 80 milligrams in a 100 milliliter bag, just to fight off the infection that the patient does have. And the patient's also going to be getting sodium chloride mixed with potassium. Patient's on morphine, sulfate, and oxycodone mixed with acetaminophen, PRN. So it's pretty much all the information I have for the patient right now.
Okay. Why specifically is the client receiving this medication?
Well, the patient's temperature is slightly elevated. They also their test did come back positive for E. coli, and the white blood cell count is indicative that the patient has an infection.
What action does the medication have on the body?
It inhibits protein synthesis in the bacteria.
When should you question administering this medication?
If the patient has respiratory distress or failure, if they have renal failure, they have severe diarrhea, or if they have any history of allergic reactions to gentamicin or antibiotics within that class.
Does the medication have a therapeutic serum level?
5 to 10 micrograms per milliliter. Above 12 is going to be toxic, and before administering gentamicin a second time, you're going to want to make sure that the trough level is below 2.
Which vital signs must be monitored?
I'm going to check all of them, but especially respirations and temperature.
Which physiological parameters should be monitored when the medication is being administered?
I'm going to check daily weight, intake and output. BUN and creatinine are going to be the main ones that I look at, and I'm also going to keep an eye out for any allergic reactions.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
Just to know the signs and symptoms of what can occur with taking gentamicin, as well as just to keep an eye out for any allergic reactions like ringing in the ears, severe dizziness, weakness, and also just take the full course of the medication.
What interventions must be taught for taking the medication safely at home?
For gentamicin, it's usually going to be administered in a hospital setting, IV, but it'd be the same thing, just to be aware of the signs and symptoms, allergic reactions and adverse reactions of this medication, and also just to take the full course of this antibiotic treatment.
What are the side effects and potential adverse reactions?
Ataxia, vertigo, ototoxicity, and nephrotoxicity.
How will you know the medication is effective?
The white blood cell count is going to be the biggest indicator as to whether the medication is working properly.
Okay, that's it for now.
Okay, so before I go into the patient's room, I'm going to go ahead and I'm going to look at my chart here, make sure I have my right patient. I'm always going to want to check the right, the 5 rights, make sure I have the right patient. I know the medication that I'm giving, the time that I'm giving it, the amount that I'm going to be giving, and then the route that I'm going to be giving it. So I'm going to be giving him sodium chloride, 0.9%, potassium at 125 milliliters an hour. Looks like it's going to start at 1400. It's going to be IV, it's going to be continuous. I'm also going to be giving gentamicin piggyback, Q8 hours, and it's going to start at 1400. And it looks like here for the gentamicin, it's going to be an 80 milliliter bag, 80 milligrams in a 100 milliliter bag over the next hour. So check my patient, just see here that they have no allergies. I'm gonna go ahead and pull my medication. So I pull my medication out. I'm gonna check the expiration date, and I'm gonna check that everything matches up with the MAR, that the name does. I'm gonna check for any puncture holes in the bag. I'm gonna do the same thing with my second med. I'm gonna make sure that this med matches up with what it says in the MAR. I'm also gonna check the expiration date, check for any puncture holes. If I have any questions, I can go ahead and like check a drug pharmacy book. I can contact the pharmacist, just to see if anything has to be done prior to the administration of the medication, or if I just have any questions if something doesn't match up. So at this point, I got my meds pulled, and I'm gonna go ahead and wash my hands and go into my patient's room. Hi, how are you, ma'am? I'm Matt. I'm a student nurse. I'm a nurse, and I'm here with student nurse Jessica, who's going to be following me around. Could you go ahead and give me your name and date of birth?
Yeah, I'm Matayan. I'm 8 years old.
Do you have any allergies?
No, I don't.
Okay, great. Well, your white blood cell count's a little elevated, and you did come back positive for E. coli. So we're going to go ahead and give you an antibiotic, gentamicin, okay? And this is going to help to pretty much fight off your infection, all right? So I just want to make you aware of a few things before going ahead and give you this medication, just to look out for. If you have like any like generalized weakness, like really like bad weakness in if your heart's like beating out of your chest, if you have like any ringing in your ears or like any dizziness that you're experiencing, just like please go ahead and like notify one of us, because those are going to be the main important things. All right. So
Okay.
I'm going to go again and get this medication ready. Is it all right with you if we start this medication?
Yeah.
Okay.
Thank you.
Perfect. Okay, so I'm going to go ahead in my MAR. I'm going to check my patient again. I'm going to check the MAR for allergies. So the patient verbalized they don't have any allergies, and I would also see here on the MAR that they don't as well. So, first thing I'm going to do is I'm just going to go ahead and flush, just to make sure that it's patent, that there's no infiltration, like where I'm going to be administering the IV. Okay, perfect. So I got my alcohol swab here. Alright, so I'm going to wipe this out for about 15 seconds. I'll let it air dry for 30. Alright, Mrs. Yarn, if you feel any discomfort, just go ahead and let me know. Just going to put a little bit of saline in here, okay?
Okay.
So I'm going to check for any sites of like swelling, just to make sure that this is actually like patent, that I can actually have like a solution flow through here correctly. So I'll probably push like 5 mLs in, just to see. Everything looks like it's flowing well. I'll go ahead and put that in the sharps container. Wash my hands again. So that I've got that, I'm going to go ahead and get this medication ready to administer. So I would be scanning this in, but I'm just going to go ahead and type it in manually. Alright, so I have my green light here. I'm going to always just double check everything here, make sure that I do have sodium chloride 0.9% with potassium chloride. I'm going to make sure that I know the amount that I'm giving. I'm going to give 125 milliliters per hour, that I have the right patient, the right time, the right amount, the right route, and the right dose of this medication. So I do have all of these things. I'm going to go ahead and spike my bag. I'm going to prime it, but I'm just going to go ahead and we're going to be using a dial flow. So I'm actually just going to connect the dial flow and I can prime all of it together. alcohol swab here. Okay, so my tubing looks okay. Just gonna get it to flow through here. Okay. We've used this bag a few times, so it may take a second to actually get anything going through. Okay, so now that that's working, I'm gonna go ahead and clamp this. Okay. Now because I turned my back to this, I'm gonna go ahead and use an alcohol swab again. Okay, so I'll clean that for 15 seconds, wait. I can hook this up. Now before I actually start anything, I'm gonna make sure I'm doing this one at 125 mLs per hour. So I'm gonna set my dial flow. And I'm gonna unclamp this one and just let it run. Now I'm also going to put on a label here. I'm just going to put my name, the amount of the medication, and the time that it was given. Okay. So I'm going to type any notes that I had here, the site that I gave it at, time that the medication was given. I'm going to make like any notes. I'm going to type in the dose that was given, the amount, anything unusual that may have occurred. My initials here. Okay. So now that that's flowing, I'm going to go ahead and start my gentamicin. So same thing, just type in, I'm going to scan this in basically, but I'm doing it manually. Okay, so I got the green light here. Once again, I'm going to check my patient, or make sure I have the right patient, right medication, the amount of the medication, the route, and then make sure I have the right dose here. So yep, I'm giving this IV piggyback. I'm going to be doing a 100 milliliter bag over 1 hour. So check my medication, just make sure everything matches up once again. Go ahead over here and grab another alcohol swab. So I'm going to check my tubing. Spike this bag again. What I can do is I can hook this up. I'm going to put this bag lower, my primary bag. I'm actually just going to prime it using the backflow method. So I'm going to use another alcohol swab. I'm going to clean off this site. Um, 15 seconds, I'll let it dry for 30. Because I have this medication already hooked up and I'm going to unclamp it, I am just going to want to make sure my dial flow is put at 100. I don't want it to flow at all when it's not on 100. So I'm going to do this. I can unclamp it. And then basically the gravity is just going to take it and it's just going to, it should like backflow up into here. Okay? So now that this is primed, I can hang this back up. I'm going to be running this over the next hour. So I'm basically going to let this run at 100, and then I'm going to come back in an hour, and then I'm going to basically switch it back to 125. That way that this back can finish off running, okay? So you feel any discomfort? Like in any pain, everything is okay?
Yeah, I'm good. Thank you.
Okay, great. So I'm going to go ahead and put on another label. Just going to put my initials, the medication I gave, the amount, and then the dates as well. So go on, hook this label up here. Type in the same information, just the time that I gave the medication, anything unusual that I want to note, the site that I gave it, the amount that I gave it, the amount per hour, and the amount of the bag as well. So I'm going to go ahead and initial this.
No, we already got it, but we made our videos, so we just want to make sure that if we can possibly sit down with you and just look over it.
Okay. So now that that's done, I can finish like any other patient charting that I need. So everything in tomorrow has been saved. All right, Mrs. Yarn. I don't know if you remember some of the side effects that I discussed with you about gentamicin. Do you mind just repeating a few of those back to me, just to make sure that I just want to make sure that you understand as well.
Yeah, I might experience dizziness and some ataxia. You told me. I know it's my weakness on my body, and then
Right, correct.
I'm trying to think.
Just some ringing in the ears.
Yes, ringing in the
ringing
ear. Yes, I
that's gonna be
remember
a main
that.
one you want to look out for.
Yes.
Okay, well, I'm just going to go ahead and lower your bed. If you have any discomfort around like this site here, the IV site, just go ahead. I got a call light here that I can put next to your bed. Just go ahead and ring the call light, and one of us will be in. Or if you feel any discomfort, don't hesitate to use the call light, and a medical professional will come by to talk with you. All right?
Okay.
So if you need anything else, just use the call light, and I'll be back.
Great. Thank you.
So now I'm going to exit the patient's room. I'm going to wash my hands.
Okay, were there any pertinent pieces of information you reviewed before administering the client the medication?
Yeah, we just looked over like at the patient's like white blood cell count. Yeah, I mean just to make sure that follow the doctor's orders.
Did this information affect your decision to administer the medication?
It did not.
Did this information affect how you administered the medication?
No, it did not.
Okay, that's it.
Thanks.